Hello, everyone. Today is Monday, June the 1st, 2026, and you have joined Ask a Care Navigator, Mondays with Maureen. Hello, everyone. My name is Maureen Williams, and I'm the Director of Care Navigation here at Four Seasons, the care you trust. And we try to create this space on most Mondays to talk about issues associated with living well and aging well, and perhaps how Four Seasons may be of service. If you have any questions, you can always call us at 866-466-9734. Or even better yet, go to our website, which is fourseasonscare.org. Please spell out the number 4, fourseasonscare.org. And we're always happy to help you and answer your questions, or at least get you pointed in the right direction. And I'm so grateful to the Van Winkle Law Firm for serving this year as this program's title sponsor, Ask a Care Navigator, Mondays with Maureen. The Van Winkle Law Firm is one of the most respected and established law firms in North Carolina, providing exceptional legal representation to individuals, families, and businesses in personal, commercial, business, and estate planning matters. And I particularly interface with this group on estate planning matters. If you want to know more about Van Winkle Law Firm or to schedule a consult, please go to the website, which is www.vwlawfirm.com. And I want to thank all of the attorneys who've been special guests on this program in recent months. Thank you very, very much. Well, today I wanted to talk about depression and dealing with depression, and hopefully to give you all some hope. And I'm sharing this because I'm noticing a bit of a trend in my life with those I love and those I know, both personally and professionally. So I thought I wanted just to crack this egg open and bring it out into the public, because depression is not a natural part of aging. Depression is not a natural part of aging, and I'll be repeating that. Everyone can feel sad or blue sometimes, even when someone as upbeat as I am. I have my moments. But when that sadness, those feelings of sadness persist and begin interfering with your normal everyday life, it may be depression. And it's just not a normal part of growing older. And I want you to also hear some hope. It is a very treatable illness, much like diabetes or heart disease. Did you know that 15 out of every 100 adults over the age of 65, that's 15%, in the United States are dealing with depression? And I think that might be a low number. There's help out there. And depression is not just a passing mood. It's just not something that'll just go away. It's different. The depressed person will suffer from symptoms that interfere with his or her normal function for a prolonged period of time. That is depression. And recognizing depression in older adults is not always easy. The current population of older Americans came of an age when depression was not understood to be a biological disorder and a medical illness. And so they don't want to be perceived to be crazy or to have some sort of character flaw or weakness. That's a big deal. There's quite a bit of stigma. It's not a passing mood. And someone suffering from depression cannot just get over it. It's a medical, biological illness. And it must be diagnosed and treated by a trained professional. Unfortunately, untreated depression can last months or even years. And I've witnessed that. When it is properly diagnosed and treated, get this, more than 80% of those suffering from depression recover and return to their normal lives. I think that's hopeful. So listen up if you know someone who you're concerned about, okay? There is hope out there. Now, I want to share the most common symptoms of depression in late life depression for older Americans, older adults. So here you go. Persistent sadness that lasts 2 weeks or more. Feeling slowed down. excessive worries about finances and health problems, frequent cheerfulness, feelings of worthlessness or helplessness, weight changes, gains or losses, pacing and fidgeting, difficulty sleeping, too little or too much, difficulty concentrating, wow, and physical symptoms unexplained, such as pain or gastrointestinal issues. Those are symptoms of late life depression. Another one might be is when people start withdrawing from their regular social activities. And they may not explain this as a medical illness, but they might give different reasons, such as, it's too much trouble to go out, or I don't feel well enough to do that, or I don't have the energy. Beware if you hear that sort of thing, particularly if these person's normal, much loved social activities fall off the scale. People may also neglect their personal appearance, or they may start to cook less and eat less. They may have difficulty sleeping, I mentioned, weight loss, or physical pain with no apparent reason or explanation. Depression can vary. There are different levels and different types of depression. That's why it's really important to see your healthcare professional so you can get a proper diagnosis and make the correct treatment. It's so important. I was with a client recently at an oncology appointment, and the doctor was asking questions about her mood and how the client was feeling, and she admitted to her mood being a bit down, not holding her current medication that she was taking wasn't holding her, and the doctor was able to adjust that very easily. And the client's mood, interestingly, improved almost immediately. Sometimes it takes longer, but she felt better immediately, and it's helping her go through her treatments. It can be done, y'all. I want to give you hope. Now, you also need to know that depression can happen to anyone. It's not because you're a bad person, you've done something wrong. It can happen to anyone. And sometimes depression will occur for no apparent reason. Remember, it's a medical or biological disorder. Life changes can prompt this for sure. Chronic or serious illness, interesting, is the most common cause of depression in the elderly. Did you know that? Chronic or serious illness is the most common cause of depression in the elderly. And interestingly, the loss of a lifelong partner or a friend is a frequent occurrence later in our lives. And it is normal to grieve after such a loss. But if those feelings of grief persist and it becomes depression, instead of bereavement, if that grief persists and you begin to change your normal habits or behaviors because of it, including symptoms like this: guilt that is unconnected with the loved one's death, more profound thoughts of one's own death, persistent feelings of worthlessness, and an inability to function at one's usual level, difficulty sleeping, and weight loss. So it's bereavement, feelings of sadness, but if it persists into some of these behaviors or thoughts or feelings, you may be dealing with depression. And there's help for that. That's what I want you to hear. It's very important. So depression is treatable, and that's really where we're going here. Depression is treatable. Remember, over 80% of those dealing and living with depression have very successful responses to treatment. And most depressed elderly people can improve dramatically from treatment. There are highly effective therapies now for depression later in life. And common therapies and treatments include psychotherapy, antidepressant medications, and electroconvulsive therapy. So let me briefly describe each of those. Psychotherapy can play a really important role in the treatment of depression with or without medication management. This type of treatment is particularly helpful for those living with mild or moderate depression. It is really important that the depressed person find someone with whom he or she feels comfortable and who has experience with older persons. That can be done. I'll tell you shortly. Antidepressants work by increasing the level of neurotransmitters in our brain, the chemicals that take messages from one nerve to another in our brains for physical function, for emotional and mental function. And a frequent reason and that many people don't respond well to antidepressant treatment is because they just don't take the medications properly. They think, well, it's not helping fast enough, so I'm not going to take this medication. I worked with a client who that was exactly her statement. It's not working fast enough, so I'm not going to take it. Don't do that. Stay with it. Talk to your daughter. There are more, your doctor. They have more tools in their toolkit for you. Take the medications as prescribed. And usually antidepressant medication is taken for at least 6 months to a year. Typically, it takes 4 to 12 weeks to begin seeing results from antidepressant medication, so you have to be patient with this process. And I'll be the first to admit, I've never suffered from depression. I've never been diagnosed with depression. I've never even had feelings of depression. And yet I have to believe that all the evidence and the research that doctors are saying, give it time, give it 4 to 12 weeks, work with your doctor on that. Don't give up. And you need to know that these medications are not habit forming or addictive. So that's a concern for many people, many of our current elders. It's not habit forming. It's not addictive. And the third type of treatment is electroconvulsive therapy. Now, before you get too scared about hearing that, it has come a long, long, long way. It's one of the most safe, fast-acting, and effective treatments for severe depression. I want to repeat that. It's one of the most safe, fast-acting, and effective treatments for severe depression. The use of electroconvulsive therapy, or ECT, has come a long, long way just in my lifetime. It's the best choice for anyone who has life-threatening depression. It's come a long way. There's a process that goes with this, but it's very safe, fast-acting, and effective. Well, I want you to hear that depression is a highly treatable medical condition. It is not a normal part of growing older. And as with any other medical condition, consult with your primary care physician. If you feel you're having feelings of depression, or if you believe your loved one, your parents or your grandparents might be flirting with depression, please, if these symptoms that they're having interfere with their everyday life, there is help to be had. Please take action. And you need to know that there are geriatric psychiatrists out there who specialize in just this issue, geriatric depression. I was once visiting with a client to a geriatric psychiatrist, and this doctor said, we have many, I think hundreds of tools in our toolkit. Let them work through it for you. It may not be fast, but they really do want to have your best interest at heart. Now, I want to share with you some practical tips for you if you for approaching someone you love who you think may be depressed. A first tip is to start with an I message. An I message, something like, I notice you're not your same old self lately. You seem sad, and I notice that you aren't enjoying things as much lately. Come at it with what your observations are. I observe, I see, I know, instead of you're depressed. That won't get anywhere, particularly if it's your parents. Another tip is to give examples of people who have been successfully treated for depression, such as, I had a friend who was having the same thoughts and feelings as you and behaving the same way, and she talked to her doctor about it. And the doctor put her on some medication, gave her an antidepressant, and it took a little while, but she feels so much better now. She's like a new person, or back to being herself again. Share some positive examples. If depression runs in here's another tip. If depression runs in your family, try to share some hope. Grandpa, I remember, dealt with this, and it was hard for him, but he asked for help. Finally, or I talked to him about it. And you need to share with your current loved ones, the good news is that nowadays there are new medications that are very effective. The older ones took a lot longer to be effective, and they had terrible side effects. Yes, there are side effects to these current medications, but there are new meds that are very effective. Another tip involves talk therapy. It can often ease a temporary condition, but I also believe, and others do, that talk therapy is an essential part of a permanent solution, permanent healing, or permanent treatment for depression. Ask for a referral to a good therapist who specializes in working with older adults. In fact, go to www.psychologytoday.com or just psychologytoday.com, and you can filter through the therapists who are in your area who might specialize in treatment of depression, particularly in older adults, and those who accept Medicare, because frequently that's an issue. Some of them will also do online therapy as well if access is an issue. If your loved one lives alone or is isolated for any reason, changing settings could work wonders. I've seen this happen. Maybe sometimes share with your loved one, maybe it's time to consider trying an assisted living community as a respite from your daily life, particularly if it's in isolation. It can work wonders. And you can share with your loved one, this won't be forever. Just try it for a month, perhaps. Some people find that once they move to a community like that, and they have all this social interaction and people talking to them and having great relationships, that they might want to stay permanently. And that might be assisted living or even a senior community. They might just find this is the best thing since sliced bread. I want you to hear that there is help for depression. It is not a normal part of aging. There is help. Your local area agency on aging might be able to provide local resources to you, many of which may be free. Our own local Land of Sky Regional Council, which is our AAA for 4 counties here in Western North Carolina, has wonderful resources. And they do so much to support and engage seniors in our community so that people can age well. They do so much to support our older Americans. 4 Seasons can help as well. You know, if your depression or your loved one's depression was triggered by the loss of a loved one, our 4 Seasons grief support services can help point you in a better direction. And you know what? It's free. Our palliative care providers are very mindful of assessing for and recognizing signs of depression. And they can even recommend treatment or provide medical treatment for you. They're wonderful. Of course, palliative care is covered by insurance, Medicare B and private insurance. And in fact, our care navigation team, we're aware of many resources in the community, including psychiatrists and therapists who make house calls. So I just want you to know, depression is not a normal part of aging. I think that's my mantra today. Now, I need to share with you that information from today's session was gleaned from an article from the American Association for Geriatric Psychiatry and from Linda Fedrini Johnson's book, The Empowered Caregiver. I do feel very strongly about this topic. I have been observing it more and more in recent months, depression, and clients, family members, people I know personally. There's hope and there's help. And I can only imagine, rather, how hard it must be to live with depression, because I can't totally imagine it. I need you to hear there's help out there. So if you have any questions or comments about anything associated with 4 Seasons, please give us a call at 866-466-9734. Or please go to our website, which is 4seasonscare.org. So join me next Monday, June the 8th, 2026, at noon for another episode of Ask a Care Navigator, Mondays in Maureen. And I'll share more with you about how we can help you live well and age well. Thank you so much.